Changed my life, honestly, and just made me feel normal again.
Nice work. Giselle was a patient with a non-contributory medical history. She had pain radiating from the lower right area of her jaw.
I knew something was wrong. I knew something wasn't right because I was in pain, everyday pain.
Her dental history showed that she saw a dentist, and the dentist said to her, "You have an unrestorable caries tooth. We need to take this tooth out and place a dental implant." So she went ahead and saw the surgeon. The surgeon took the tooth out, placed the bone graft, and then shortly after the bone graft was placed, she started really having tremendous amount of pain. Now, mind you, she wasn't in pain to begin with, but after the extraction and the graft was placed, a couple weeks later, she had extreme amounts of pain.
I was every day in pain, and I was giving up. I was like, I don't know what to do. It was affecting my everyday life.
The problem is that her pain continued, and it was seemingly getting worse. So she was then referred to a whole host of specialists.
I was just at that point, I said, I don't know what to do anymore. I feel like giving up. This is super painful. I can't live like this. And so my sister was actually doing research for me. She's like, you know what? I found this dentist and his reviews are great and just something about him, go check him out. Maybe, you know, he can tell you something different. And that was the best day of my life because he was the first one to say, it could be the bone graft.
After treating multiple cases of failure, I did see a line mark or a lineage of where you could see the bone graft versus the native bone. And I said, you know what, that might be the problem. You know, that might be the answer. So we opened up the tissue, and sure enough, the bone graft particles were there. They were encapsulated. It was fibrous bone graft particles that were embedded into the flap, and it was just a cystic mess. So we were able to detoxify the area, laser sterilize the area, and we were able to use some growth factors and clean up the area to the point where I felt confident that she was going to get the best angiogenic healing response possible.
After the procedure of taking the bone graft out, I slowly got better and better and better. Inflammation has gone down, and I continue to be a patient of Dr. Firm. It's really made my life a lot better. The
emotional and financial toll of pain is astronomical. It was really nice to see somebody evolve and come out of that pain because, that's devastating for patients, devastating. And it could have been so easily prevented, and it turned out to be the bone graft material. So again, when we say bone is bone, it's really not. And we have to look at the cost that it can cause if it fails, as well as the real severe emotional problems, as well as emotional chaos it can cause in a patient's life.